It's a warm welcome here in our studios in Serekunda. This is Star TV News with me, Sarah Kamara. In the headlines tonight, new lancing launched for nurses and midwives in the Gambia. BJ Creation donates face masks to Ministry of Trade to support frontline workers. Car burns to ashes as Brikama resident blame the fire and rescue services. And on the international scene, top US expert warns of needless death over easing virus curves. COVID-19 cases soar in Brazil. Chile admit accusation of neglect. Afghan president orders operation against Taliban. Those were the headlines, and now the news in details. Mafuji Bojang, registrar at the Gambian Nurses and Midwives Council, reveals to Star TV the reason the council need to upgrade the professional lancing of the Gambian nurses and midwives. He said the changes are due to the nature of the previous lancing. Dado Cham files in this report.
As a council which has been in existence since 1992, we've been having different types of licensings, which were actually more of paper-based. And as you can see by the samples later, you will realize that the council started with the paper type, where names will be written, and then for every individual, using this as an example, you will have where the name is to be written in pen, and then the person's registration number, and the date the person was first issued this license, which we call the initial registration date, are all written in pen. And then the date the license will also expire is also written in pen. So basically everything was on pen. So annually, people have to come to renew. And as you come to renew, this thing which was written last year has to be repeated again for you. This was the system from that from the 90s until the year 2015.
Bojang went further to explain the procedure in obtaining the professional nursing license from the council, as there are proactive measures put in place for the scrutinization process, and the license can never be forgotten since it is reliable.
As far as forgery is concerned, that is going to be very difficult with this system, because it means you have to be here or somebody have to represent you here to get it done for you. But if you look at it size-wise, it is actually difficult to maintain. And also, it is also not available on demand. For example, if you go around and you ask a nurse, "Are you a practicing nurse?" "Yes." "Are you licensed to practice?" "Yes." "Where is your license?" It's difficult to carry this thing away. But compared to the biometric, which is sizable, small as it may be, is portable. Yes, as far as the process of obtaining this licensing for now is very reliable. This licensing, we have to make it clear that it is not only for those who are applying for the first time, but it is going to be given to you after the first obtaining. That means you will be renewing this licensing at least every 2 years. And that means by the current system, if you are around here, let's say, for example, a nurse who comes to register this year would get it expired 31st of December 2021.
Regarding the credential for the lancing, Bojang Clare stated that any nurse found practicing nursing without a license will be punished accordingly.
According to the Nurse and Midwives Act 1989, it is illegal to practice without a valid registration license. And then, unquote, any person who is found wanting, meaning any nurse who is practicing without a valid registration license, could be fined up to nothing less than 2,500, or could also go and serve a jail sentence of nothing less than 2 years, or both a fine of nothing less than 2,500 and an imprisonment term of nothing less than
2 years.
According to Bojang, there are strict measures put in place in the council before being issued a lancing. One must sit for an examination called Gambia National Nurses Examination after a series of discussion and fact-finding in 2019. The Nursing and Midwifery Council, Directorate of Nursing and Midwife Services, West Africa College of Nursing, Gambia Chapter and National Association of Gambian Nurses and Midwives all joined their professional colleagues globally to commemorate the International Day of the Midwife on 5th May, the International Nurses Day on 12th May, and the Year of the Nurses and Midwives Year 2020 in the remembrance of Florence, Mother of Nurses, and her contribution to the world today. Reporting for Star TV News, I am Dado Cham.
Stress-Free Bakufu, an association formed by young Gambians from different occupations and different communities, on Monday visited Tanka Tanka to donate food and sanitary items like bags of rice, sugar, cooking oil, detergent, and other valuable items to support in the fight against the global pandemic COVID-19. Omar Job sends us this report.
As cases soars in the country, Stress-Free Bantaba Association deemed it necessary to put hands on deck and help Tanka Tanka in fight against the coronavirus. Speaking at the handing over ceremony, Babukar Jete, an executive member of the association, said he sees the gesture as a social and cooperative responsibility to give back to the communities, and Tanka Tanka is not an exception since there are mental ill individuals who need support.
We feel the patients here are mentally challenged. These are people that we stigmatize in the country here. If you see a mentally challenged person outside, nobody wants to associate with them. So if there is a venue in the country here that seeks to help the mentally challenged people, I think it should be a responsibility for each and every Gambian youth organization or group to give back to that place and see it as a responsibility to help those people to meet their targets.
Mr. Jete urged philanthropists and institutions to put their attention to support mental health clinics as they are part of the society. Lamin Barrow, officer in charge, said he is grateful about the association's gesture and see the association effort as partners in services he rendered to the vulnerable.
I am so impressed having you people here today.
Thank you.
Gambia is a bigger nation when it comes to the scope of its population. But there is just a few number out of that population that reconsider what's to be done for people that are vulnerable. And I today stand to serve the vulnerable. So when somebody comes along to say, I stand beside you to serve along with you, I am impressed. And that impression goes to your association, your group. You've proved yourself to be at the same kick level square with me.
He further noted that the items will go a long way in serving them and they are not seeing it as something small but one of the biggest items they receive, and urge Gambians to emulate the association's effort for supporting the vulnerable people.
But to be honest, maybe to you it's a small thing, but the people you are giving it to is one of the biggest things they receive. So to be honest with you, this is something great. And I call on to challenge people outside there. See these people as role models of service to the vulnerable people. They did something today that everyone should learn from. These are young, able Gambians who has families, who has brothers and sisters, that they can invest into those. But in this difficult time, they say no to all of that just because they wanted to look at a specific, significant, important people.
Mr. Moduba, a senior nurse at Tanka Tanka, also thanked the association for coming to their aid and noted that the foodstuff will serve them in a long way.
What you've done today shows that there are people out there in the community who are concerned about the well-being of our patients. This will also go a long way in complementing government efforts in providing good services for the patients here. And once again, I want to tell you a very big thanks. And I hope other individuals or group of people will emulate your good gesture.
Various speakers at the handing over of the items, which include Fatoumata Jaite, the secretary of the association, and Fatouba, a member, said they are delighted to support Tanka Tanka for the gestures as they are brothers and sisters of the nation who need the support. For Star TV, I am Omar Diop.
See Trade Gambia, a project that aims to increase Gambian women's entrepreneurs' participation in trade, on Tuesday, 12 May, received donated face masks from BJ Creation to support frontline workers in the fight against COVID-19. Maria Madem was there and she now reports.
Speaking at the presentation, Mr. Abdullah Jame, the Deputy Permanent Secretary for Trade and Regional Integration at the Ministry of Trade, said on behalf of the PS, he appreciates BJ Creation for the gesture and initiative, noting that the donated materials will be distributed to the frontline workers in order to support the national endeavor to curb the COVID-19 pandemic. He said the donated items from BJ Creation is part of their contribution to See Trade Gambia in supporting the frontline workers with face masks. BJ Creation is a tailoring and small-scale manufacturing company that shows enticing outfits for both official and casual wear. BJ Creation also has a social mission of training aspiring youth, especially girls, into tailoring, design and manufacturing. Maria Madem reporting for Star TV News.
In the early hours of Tuesday, a car burned down to ashes in Brikama, but residents blame the fire service for ignoring the fire incident as they never responded to their call on time. Dado Cham reports.
A resident of Brikama blamed the owner of the car for not being observant as his car resulted to the fire. The anonymous man said it is very important that every driver monitor his or her car every moment to avoid such complication. He further revealed that the car started showing smoke from Gunjur Johnson down inside Brikama. Another witness said no one is to be blamed other than the fire rescue services because they have been called on several occasions but were told that the fire rescue services were attending another fire incident and they also had a breakdown on one of their vehicles. The people later used sand to try stop the fire and that was done by the youths who came out to give a helping hand. The owner of the car, Pa Lanjai, said he cannot explain how the fire started as he was just driving when he started to see smoke coming out of the car and he decided to make a stop to see what was going on. Mr. Njai added that as a citizen paying tax and any other thing, government authorities should be able to stand by them.
So, but now they have informed Serekunda Fire Service Station that are on the way coming, but still now Janni Fire Service it's almost coming to 30 to 45 minutes. Fire Service, they are not on the ground at this point.
The spokesman of Gambia Fire and Rescue Services, Peter Jiba, said like any other fire, this one was of course devastating because Brikama could not attend to the scene. They were incapacitated by the lack of the fire rescue services. The fire appliance belonging to Brikama is not in order. It's an old fire engine. It could not move, so we had to call Serekunda to intervene.
What I want to tell you here is that they used to say firefighters' vehicle never have vehicle. They never have water. They used to go for emergencies without having water. Even yesterday we were accused that the fire that we went for, we were not with full capacity of water. So what I want to show the people and the whole public is that even our old fire engines are always with water. This fire engines is not been working for more than 6 months to 8 months. It is off the road. But despite the fact with all that, it is still having water with full capacity. Even our vehicles which are on off the roads are having water. So I see no reason why the vehicle which is on the road, going for emergencies, it is not having water. So it doubts us. So, as you can see, it is just chorus, but it is pure water that we can use for our fire.
But the problem now is there is a water here. Yes. We understand that. Yes. Why are you not responding?
But we are responding. It is just that the vehicle that is on the road has some mechanical problem. It has a mechanical problem as of now. The engineers are working on that issue. Since last month...
When did this vehicle has a problem?
That mechanical problem. Yes. It occurred since last 3 days back. Sunday. Is it Sunday? Friday, last Friday. It went off the road last Friday. So throughout the weekend up till now, our engineering people are making sure that it come to on the road. That is why if in this car fire, we were unable to respond to that fire. Because we cannot go to fire without water that we extinguish the fire.
According to him, Kotu was also called and they were able to quit the fire. The cause and extent of the damage is being investigated. Adam Masanyang, the senior divisional fire officer in West Coast region, also justified that they used water to fight a fire incident, but in Brikama, they did not have enough hydrant. If there was enough fire hydrant, one could have said they will use and plug their equipment in the nearby Hadrang to fight up the fire. Reporting for Star TV News, I am Dado Cham.
And now, news beyond our borders. The top infectious disease expert in the United States, Dr. Anthony Fauci, has again cautioned against lifting coronavirus restrictions, saying it could cause needless deaths. But several states have continued to ease these curbs, despite the death toll rising above 82,000, encouraged by U.S. President Donald Trump. Al Jazeera Mike Hanna reports from Washington, D.C.
It was a meeting of the Senate Health Committee like none before. 3 of the witnesses and the committee chairman were not present because they were self-isolating or self-quarantining to some degree. One of them, Dr. Anthony Fauci, came under attack from a Republican senator for his advocacy of a cautious approach to the easing of restrictions.
And as much as I respect you, Dr. Fauci, I don't think you're the end all. I don't think you're the one person that gets to make a decision.
Dr. Fauci responded by saying he was guided by science and undeterred by the hostile questioning repeated his warning against states dropping mitigating measures too quickly.
There is a real risk that you will trigger an outbreak that you may not be able to control, which in fact, paradoxically will set you back, not only leading to some suffering and death that could be avoided, but could even set you back on the road to trying to get economic recovery.
A position backed up by some of Dr. Fauci's colleagues, who also gave evidence to the committee. The experts were unwilling to be drawn into detailed discussion about testing protocols within the United States. But Dr. Fauci is on the record as insisting that they are not yet at a standard to effectively track the virus. This a critical factor in reopening the society. It's an opinion that's apparently largely ignored by President Trump, who's been encouraging states to open up as soon as possible. The sign an inaccurate reflection of the reality, as is the president's contention that the U.S. is the global leader in testing protocols.
In the span of just a few short months, we've developed a testing capacity unmatched and unrivaled anywhere in the world, and it's not even close. This is a core element of our plan to safely and gradually reopen America. And we're opening and we're starting, and there's enthusiasm like I haven't seen in a long time.
There certainly was an enthusiasm in this Colorado restaurant that flouted the state shutdown order by opening this past Sunday. The owner tagging President Trump in a tweet, saying he was opposing what he called the overreach of the state governor. The restaurant has now had its license suspended for a month, but these scenes are the stuff of nightmare to those health experts cautioning against undue haste. Mike Hanna, Al Jazeera, Washington.
In Brazil, where the coronavirus death toll is above 12,000 and rising, local government have imposed mandatory lockdown in the face of President Jair Bolsonaro's failure to take it seriously. While in Chile, the government is being accused of dragging its feet as infection soars. Al Jazeera Latin America editor Lucian Newman reports from Santiago in Chile.
In the city of Niterói, local authorities are restricting entry from neighboring Rio de Janeiro, which has the second highest COVID-19 infection rate in Brazil.
It's necessary because the population is not respecting social distancing, and that affects more people. If the virus isn't stopped now, who guarantees that it will be stopped later?
It seems logical enough, but not to President Jair Bolsonaro, who is balking at calls from governors to impose a lockdown. First, he went on a jet ski escapade on the day Brazil's death toll surpassed 10,000 and called fears of coronavirus paranoia. Now, as the toll approaches 12,000, he's issued a decree to allow barbershops, beauty salons, and gyms to reopen as essential services. The prestigious British medical journal The Lancet says Bolsonaro may be the single biggest threat to Brazil's fight against coronavirus. In Chile, the government is also under fire, accused of taking too long to impose widespread quarantines in the capital. Infections have soared from 15 to more than 30,000 in just 2 weeks nationwide, the majority here in Santiago. The death toll is still relatively low, but that's likely to change very quickly. This is the entrance to the emergency room of one of Santiago's oldest and largest public hospitals. The beds in the critical care units are now almost full, and that isn't even the worst problem. It's the lack of nurses and other technicians that are needed to care for patients that need emergency care. The Air Force is airlifting recovering patients to other provinces to share the load. Short-staffed and with 90% of beds taken, the government has declared what it calls the battle for Santiago. Clearly worried, President Sebastián Piñera is overseeing the arrival of massive amounts of protective gear and more ventilators.
En estos tiempos de adversidad, these next weeks will be very challenging and will require the best of all of us.
Con la colaboración de todos los chilenos.
But many say the government should have done more already, like these mourners who are waiting for a loved one to be brought out for burial. Abel says he lost his nephew and his uncle in less than a week.
Now we're all dying because of the incompetence and greed of our leaders who refused to declare a total lockdown in Santiago. We were supposedly experts, prepared for the worst, but it's a bunch of lies.
More than half of Santiago is now finally under quarantine, but it may be too late to prevent the health system from collapsing, even before Chile reaches the peak of the pandemic. Lucia Newman, Al Jazeera, Santiago.
A deal hoped to pave the way for peace in Afghanistan could be in tatters after 34 people were killed in separate attacks on Tuesday. The president has ordered the military to resume offensive operation against the Taliban and other armed groups, but the Taliban denies any responsibility for the violence. Al Jazeera Alexei O'Brien reports.
Outside the hospital in Nangarhar, the grief is palpable, and so is the anger over the seemingly endless violence and loss.
My brother Ismail was standing next to me when I heard the bomb blast. I saw several dead bodies on the ground. Then I was trying to call my brother, but his phone was off. After a few minutes of searching, I found my brother among the dead.
It was this attack on crowds of mourners at a funeral by a suspected suicide bomber and another on a maternity hospital that pushed Afghanistan's president to go on the offensive, ordering a new military operation against the Taliban and other armed groups.
Despite our repeated call and from the international community, the Taliban have not reduced violence and instead they have increased their attacks. In order to provide security for public places and to thwart attacks and threats from the Taliban and other terrorist groups, I'm ordering Afghan security forces to switch from an active defence mode to an offensive one and to start their operations against the enemies.
The Taliban denies involvement in the latest attacks. It's largely refrained from targeting Afghan cities since February, when the group signed a landmark withdrawal deal with the United States. It was meant to pave the way for talks with the Kabul government. The Taliban now says it's the government creating obstacles to peace.
It is a big blow to this peace agreement. It shows again that the Taliban cannot deliver on their promises. And so I would say that today probably marks a milestone towards the disintegration of this agreement unless drastic measures are taken immediately by all sides and specifically by the Taliban.
Under the agreement, the Taliban promised not to target forces from the US coalition in return for their withdrawal from Afghanistan. However, the deal didn't include Afghan troops, and the Taliban stepped up attacks against them. The Taliban was also supposed to prevent Afghan soil from being used for attacks by other armed groups like ISIL and its affiliates.
Well, the Islamic State certainly is less of an issue than it probably was 4 to 6 months ago, or even less. They've suffered some battlefield defeats. There's been indications, and the Americans have acknowledged it, that Taliban have been supportive of attacks against or putting military pressure on Islamic State in Khorasan province. That was part of the agreement they had with the United States.
But the group has proven it can still launch attacks on soft targets. ISIL says its fighters were behind 4 bomb blasts in Kabul on Monday, which wounded 4 people. The UN has expressed shock and revulsion at the attack on the maternity hospital, which saw nurses, mothers and newborn babies killed. US Secretary of State Mike Pompeo is urging the Afghan government and the Taliban to cooperate to bring the perpetrators to justice. Alexei O'Brien, Al Jazeera.
And before we end the news, a recap of our main headlines. New lancing launched for nurses and midwives in the Gambia. BJ Creation donate face masks to Minister of Trade to support frontline workers. Car burns to ashes as Brikama residents blame the fire and rescue services. And on the international scene, top US expert warns of needless deaths over easing virus curves. COVID-19 soars in Brazil. Chile admit accusation of neglect. Afghan president orders operation against Taliban. That's all for this edition of the news. Please enjoy the rest of programs and join us tomorrow for more news. Thank you.